Victoria, we're definitely glad to have you here. Thank you for your time. This is a busy cardiology practice, and we want to make sure that you're going to be a good fit for the practice. So please tell me just a little bit about yourself.
So I decided to come into the health career by taking care of my great grandma. She was diagnosed with dementia, so I moved in with her, and after moving in, I really enjoyed taking care of her, so it opened up the doors. I started my career in November, and I'm now a graduate. Um, I really enjoy this career. I want to continue my education eventually, but I love, helping patients and taking care of them. And then I was, I'm sorry.
That's okay. What do you think of as your time on campus at ECPI University? What do you think were some of the classes where you had your greatest strengths?
My greatest strength classes was definitely phlebotomy is my top. Um, EKG I was pretty strong in as well, and basically all the hands-on classes I really took initiative in and did my absolutely best. I also enjoyed the lecture classes, the medical ethics and the law, so that way you get to know the correct way to do things and so you won't get in trouble. And then the EHR is definitely important, so that way you know how to log in all your information. Um, and then, of course, medical billing and coding is definitely important, especially if you want to specialize in that field. But the clinical classes were definitely my strengths.
Okay, very good, very good. Well, would you have any problems working maybe one day of the week in billing and coding and another day working behind the desk doing scheduling and patient follow-up and working in the physician's office laboratory? Would you be open for that?
Absolutely. It I would be more than happy to do whatever position that I'm putting to. The more experience I get, the better off I am.
Very good, very good. That's a very good answer. What about your proficiency in these skills that you like so much? Can you tell me a little bit about what shows your proficiency in these areas that you mentioned, like EKG and phlebotomy?
Since I take great initiative in both phlebotomy and EKG, I feel I'm more accurate and I'm going to do the absolutely best that I can. I'm going to do it the best I can in the phlebotomy so that way I and then so that way I get my certifications and every single one that I can, like the EKG, the phlebotomy, medical billing and coding. You got the EHR, but those are definitely certifications are definitely very important.
Okay. And what certifications have you currently earned?
I've currently earned my CPT, my CET, and my CCMA.
Very good. Um, can you tell me overall what's your greatest strength?
So my greatest strength is I am very hardworking and I like to learn how to do everything hands on. I am ready to learn anything that is thrown at me. My greatest weakness though is I like to take control over the situations when I'm not supposed to. But if I'm ever in that situation, I know that I'll always be a leader in case nobody else is able to step in.
Well, very good. Very good. That's a very strong answer. Well, do you have any questions for me with our cardiology practice?
Um, what is your everyday like patient, flow? How many patients do y'all see every
We
day?
typically see about 25 patients per provider per day, and we have 6 physicians, 3 nurse practitioners, and 2 physicians assistants. So we are a very fast-paced working environment. We will also, since we have a physician's office laboratory, we will have patients that are coming in just for laboratory work who may not be seen by a physician that day, but will have lab work done. So typically we matrix our patients in 15-minute increments throughout the course of a day to accommodate our 25 patients per practitioner.
Okay, that's pretty fast paced. That's what I enjoy.
Good, good.
Will I be able to, shift between like the lab and for, administrative and then working back with the patients?
We definitely cross-train all of our medical assistants. We want everybody to be an integral part of the machine so that way if somebody is sick and somebody else has to step in, they are trained in that area. Or if we have walk-ins that we need to get lab work done on or run a stat EKG or something like that, everybody knows the other person that is working in that area that particular day. They know their skill set, so they can immediately accommodate our patients and make sure that nobody has to have an unduly long wait or have any backup of the patients that we need to see that day.
All right, that's
So
great.
we definitely like people to be cross-trained and show that initiative that they want to work in all areas of the practice.
Perfect.
Okay. Did you have any other questions?
Good.
Okay. Well, thank you so much
Thank
for your
you very
time. We
much.
certainly appreciate it, and we definitely look forward to touching base with you very shortly.
All righty, thank you.
Thank you.